Yeah, just a quick review of the Healrecux silicone patellar tendon support strap. So these bands work by decreasing pain, by decreasing strain on your patellar tendon. Okay, and according to researchers, there are two ways that they think these bands work to do that. Number one is they increase the angle between the patellar and your patellar tendon. Okay, so here's your patella is your kneecap, so that sits at a certain angle, and then your patella tendon sits at a certain angle. And so when you put the band on, it increases the angle and takes stress off. The other way they think that this works is that it decreases the patellar tendon length. So those are the two ways. A few points about these particular bands. These do have an anti-slip texture design on the inside. It's kind of like a crisscross kind of pattern, so that'll keep it from moving around, which is really nice. The other thing that's really nice is that it's kind of one size fits all. So you don't have to worry about getting a small, medium, or large. They're pretty adjustable. So other things you can do for your knee pain. A few examples from this book is one resource, Bulletproof Your Knee. If you have any kind of knee trouble, definitely make sure you're strengthening your quadriceps muscle. Your quadriceps muscle is a big muscle on the top of your leg, on your thigh. So here's your kneecap, and there's your quads right on the top. So it's the main stabilizing muscle of your knee. So it's got to work in order for everything, to be pain-free. What they're finding, though, just about any problem you can name with your knee, you probably find a study showing that selectively your quads are weak. So for instance, here's research on knee swelling in the quadriceps. So this study demonstrated that even if you have as little as 20 milliliters of fluid in your knee, which is just over a tablespoon, that's enough to decrease the strength of your quadriceps muscle. So if you have any kind of chronic swelling, it could take a toll on your quadriceps, right? So it's not going to be as strong as it should be. Knee injuries in the quadriceps. So there's research showing that people have had various types of knee injuries, fractured their tibia, any kind of surgical opening of the joint. That's usually associated with quadriceps weakness. Ligament problems in the quadriceps, that's a big one. Anterior cruciate ligament, so that's like your ACL. So if you've torn or ripped it, they find, look at this one study found that people who have ruptured their ACL, 25 to 30% decreased strength of your quadriceps muscle. Posterior cruciate ligament, your PCL, and your medial collateral ligament, same kind of things, quad weakness. Knee pain in the quadriceps, having chronic knee pain is enough to kind of be associated with having weak quads. Here's a good one, knee arthritis in the quadriceps. So there's actually a lot of studies on knee arthritis in the quadriceps, basically showing that they're weaker than they should be. And also, there's studies showing that if you take groups of people with knee arthritis, and these are randomized controlled trials, and you do just quadricep strengthening, that the knee pain starts to go away. Likewise, they've also shown that people with the strongest quads, and if you strengthen your quads, it actually it slows the progression of knee arthritis, which is really nice. So a lot of associations there. Patellofemoral pain syndrome, this just goes on and on. So definitely make sure you do a quadriceps exercise. Here's something else, fine-tune control over your knee. Kind of interesting. Sometimes you have a problem at your knee, and the problem's really, your knee hurts, but there's not really a problem with your knee. It's coming from your hip. So classic cases like iliotibial band syndrome, and that's where they take groups of people with iliotibial band syndrome, they start testing their muscles, they find they have problems with their hip abductors are really weak. And likewise, there's other randomized controlled trials showing that if you take people with iliotibial band syndrome, strengthen their hip abductors, then they don't have the iliotibial band syndrome anyway. So just another place to go. Optimize knee flexibility. We all know that your knee, bends and straightens, and you need to keep it flexible. What a lot of people don't know is your knee actually rotates. About the last 10 to 15 degrees of extension, that's when you straighten your knee. It actually rotates laterally. So that's an accessory motion. There's a little test to see if you have that. So you definitely need that accessory motion, that fully functioning knee. Other things you can do, increase dynamic knee stability. Here they're talking about proprioception. So if I turn the lights out now, all of a sudden, you'd probably be able to tell me if your knee is bent or straight. And that's because you have little joint receptors in the joint and the surrounding soft tissues. Give your brain constant feedback as to where your knee is in space. And so that's your proprioception. What they're finding is when researchers go around looking at people with knee problems, they find that they actually have decreased proprioception. There's not what it should be. So lots of other things you can do. But hey, these little bands are kind of cool. The research shows that they do help. So check them out.